Hello and welcome for the Situation Report for Thunder Bay Regional Health Sciences Centre's COVID-19 response. My name is Tracy Smith, and again I'm here with a staff member to share with the community the impact that staff members have had and the way they've supported patient care throughout the COVID-19 pandemic. And today I'm here with Dominic Falsetta. And Dominic, you are user support coordinator for both Thunder Bay Regional Health Sciences Centre and St. Joseph's Care Group.
Yes, but I'm stationed in the St. Joseph's Care Group, so that's primarily where I am, but I do coverage over here too. Yeah.
So tell us a little bit about what your normal day looked like before COVID.
So there were, at the time, there was a lot of projects about to start or in progress, and so we're chipping away at either starting projects, planning projects, or completing existing projects. And then there was a day it was in March, excuse me, sorry. And so my girlfriend's a nurse over here too, and she said, yeah, there's a big meeting today, and and supposedly some people left this meeting and they were a little bit panicked, right? I don't know if there was new information that was given or whatever, but within about 20 minutes, a bunch of directors from St. Joe's started calling me, emailing me. It's like, we need laptops fast. It was just like a total panic. And it was from that day on, everything changed. So it wasn't that anything actually happened. So we've been really fortunate. I think Thunder Bay did very well with dealing with the pandemic, minimal infections. Like St. Joe's, the big fear was long-term care and keep protecting that clientele, and they did an awesome job. I think both hospitals did an awesome job. But at the time, there were so many unknowns, there was so much fear, and the panic was in the air. And that meeting ended. Within 20 minutes, I started getting bombarded with emails, calls, texts. It's like, I need this now. I need this moved now. I need this. I need that. And things changed for about, we're at that pace for 3 or 4 months, right? So first it was like, okay, we need to socially distance everybody. So there was mass amount of moves where everybody needed to be 6 feet apart. But all this evolved, right? Because basically it's okay, how do we deal with this? Okay,
and all of this refers to the information technology that people are using. So actual computers, telephones.
That's right, yeah. So first it was the distancing thing, and they're trying to figure that out. And they set up a committee fairly quickly. It was set up already, but they really kicked into high gear. And the process was pretty quick about what got approved and what didn't get approved. Everything went through them, and they decided where it fit into their, in their priorities and so on. So the first thing was a big scramble for devices, right? So it was just I happened to have quite a bit of, I had spare equipment, and the loaners I had out, I pulled them back right away because we didn't know how we were going to redeploy them. If it was going to be people working from home, they set up a war room, so we needed equipment for that. So it was just a mad scramble every day, and it seemed to change every day. The level of panic changed every day. And then within about 2 weeks, the big thing was, actually within a week, it was we need to start screening people at the door right now. We need computers right now. And so they started at the long-term care facilities, and they started asking the screening questions there and so on. And then it was no, we needed it at all our sites. So St. Joe's has, 12 sites, big and small. So it was just okay, we need to get iPads. So all the managers started volunteering the iPads because they didn't have that many spare iPads, right?
And I'm sure it became difficult to purchase iPads or laptops.
You couldn't get anything at the time. There was nothing the first month and a half, 2 months, I was just electronics was not flowing. You couldn't get it. Everything sold out pretty instantly.
Sort of like PPE.
Oh yeah, for sure.
Just a shortage everywhere.
It was crazy, and I found myself actually going to Walmart and buying I need 20 of this or 50 of that, and that's what was happening. I was just putting my credit card or whatever, and then getting reimbursed later. But that's the way it was for sure for the first month. I was making these runs to any place I knew would have what we needed.
So what was the goal for you with all of that scrambling and all of this procurement? What were you trying to achieve?
So first it was the big fear of the shortage of equipment, right? And that really wasn't there, but there was that fear. And then St. Joe's decided that it was very important because they locked down the hospitals. There was no visitors. And St. Joe's Hospital has, like, of course, a palliative care ward at St. Joe's, and they have long-term care patients. Like HRM is the biggest long-term, I think it still is. It was a few years ago when they built it, but it's the biggest long-term care home in Ontario, which is, a lot of people don't know that, but like there's 500 patients. And that facility was locked down, and their family couldn't see them. They're like, we need to, like, they need to be able to communicate with their families, like, daily. Like, they mean, like, they're going to go downhill if they don't. Like, it's a morale thing or whatever. Families are panicking. Like, just panic all around. So, like, okay, we need iPads for this now. And, yeah, so basically managers stepped up, directors, even I think there's a few VPs that just gave up their iPads. And it's like, okay, configure these. Okay, well, how do you want them configured? Well, we don't know. Right, so it was just like, okay, well, FaceTime, WebEx, like, how do you want to do this? Okay, so it started with FaceTime, right? So we wrote up the documentation about, okay, this is how you do this. And we set up, like, all these Gmail accounts, that way they could, and iTunes accounts, so they could use them instantly, right? So, it was kind of like a little bit above and beyond. Normally, IT would never do anything so non-standard, but it was non-standard, but we standardized it as best as we can under circumstances, right? So they didn't have a plan of how to do this. And then the doctors were like, or how they were actually going to utilize these devices. So St. Joe's management was like, well, PSWs will assist. Like, PSW will bring it to a patient, and they'll help them connect and so on. So there was like the learning curve on that end. So we're trying to get everybody up to speed on how to use the technology, like as far as the staff. And then there's like they got organized very quickly. Then they had like a nurse manager that was like, okay, I'll take the lead on this for St. Joe's. And yeah, so anyways, within about a month, we had 60 iPads doing televisits. 60. And we had 60 accounts, and it was all documented, and IT supported it fully. It's something we would never, ever do. Like, iPads up until then, like, we secured them, we handed it to end user. It's like, you're on your own. Like, you know what I mean? Like, do whatever you want with apps or whatever. It's secure. You've got internet, you've got email, away you go. So it was something I never thought I'd see IT doing that, but under circumstances we did. And we supported these iPads, and it's their usage 100%. So so we got up, like, these clinical teams, up to speed fairly quickly at all our sites. So there were 60 iPads out doing televisits. So within a few weeks, I know the team at St. Joe's was doing 240 televisits a week. That was within a few weeks. They got up to speed really quickly. So there were 60 iPads out, and they were all in use. They were all, like, basically with patients all the time. And, like, that's a good story for me, because I heard it, like, from the community, where it's just like, hey, you work at St. Joe's, don't you? It's like, I just want to tell you, my grandmother, she has Alzheimer's, and we haven't seen her for a month, but we talk to her every day on FaceTime or whatever, and, like, thank you. Like, so that was really nice to hear. Like, do you know what I mean? Like, it actually impacted people, help patients get through it. There was also circumstances where, like, there were, like, floors that were actually locked down. So we had a lot of iPads. So basically, the clinical teams that were, like, bringing these iPads around were like, okay, well, somebody on floor 2 wants to talk to their cousin or their wife or whatever on floor 5, and they would talk every day. So there was some husband and wife, both hospitalized. They couldn't
physically see each other.
They couldn't cross the floors because the floors were isolated at some points. I think that opened up eventually, but there was actually family members talking to one another.
So there was
they're both in the same building.
Yes, a lot of flexibility in terms of, so you were basically outfitting people so that patients and their families could communicate, so that screening could happen at doorways, so that people could work from home, where we'd never set people up to work from home before.
That's right, yeah.
So it was a big scramble at the beginning. What are things like now?
Things have calmed down, for sure. Like, as of the beginning of July, I'd say things started coming down. But first 2 or 3 months, like, the panic, the thing was, the panic was worse than what actually happened, right? But, like, maybe the panic helped really keep things under control. People were very, very cautious, right? So, yeah. But initially, it was just like, it seemed like every few days there was somebody panicking. Like, my phone was going nonstop every day, like 30, 40 emails a day, like that type of thing. It was just people just panicking. And it wasn't even like, what if this, what if, it wasn't, with a lot of them, there's nothing I could have done, but it was just like, I don't know. It was almost like everybody was expressing their panic to one another, and it wasn't necessarily an IT thing either, right? So I have to say IT, like I'm proud with what IT did. So basically, with my manager now, well, my director, Jen, you know, they created a plan where, I know we talked about this, okay, we need to start siloing, us, because we don't know how bad this is going to get. So if we all go down, what happens then? So we siloed, right? So at St. Joe's.
You mean staff members?
Staff members, right.
Right.
Yeah.
So if one person became ill and infected others,
Exactly.
we could have a huge disaster on our hands.
Exactly. So I'm responsible for all 12 St. Joe's sites, or 12 or so. Let's think they group them, so whatever. But I didn't leave St. Joe's for 3 or 4 months. I couldn't go visit another site. So it's a plan that we made. We went a bit above and beyond. It's like, okay, if we work, people from Thunder Bay Regional, once we started, basically, you couldn't visit another site. And like the tech I had at St. Joe's, he started there in February, and he was there till the end of July or mid-July, because we just locked everything down, right? And especially with long-term care. For long-term care, we had one person taking care of St. Joe's Heritage, and he was working from home. So we didn't want him to isolate. We didn't want him to be exposed to any other staff, so he worked at home. That was it. And so if there was a call at Heritage, he would go into Heritage from home. And he never saw anybody from our staff pool for that whole time. And same thing at Hogarth. Hogarth, we had one tech that was stationed there, because it's a big site, so we had one tech there, but that's it. And he wasn't allowed to communicate with anybody else. And we wiped down equipment, so if we needed to ship something to another site, we wiped it down with antibacterial wipes, and so on. So we took a lot of precautions. We probably went above and beyond, like with paranoia, right? And our concern, as being, one of the leaders in the department, it wasn't just like, I'm afraid I'm gonna get sick. Like, basically, what happens if we all get sick? Then what? Right? So, because we didn't know at the beginning, we didn't know how bad it was going to be. So, it wasn't self-preservation. Like, that's not why we did what we did. It was so service could continue if, the worst happened, right?
Sounds like you were being very responsive and proactive at the same time.
Yeah, for sure. Yeah. And the big fear, was, if we cross-expose staff and they pass something on, then we're all down. Then what? How does Meditech run? Like, whatever. And that was we're thinking worst case scenario, right? But at the same time, we didn't know. We didn't know how bad this was going to get, right? So,
plan for the worst and hope for the best, right?
Unfortunately, the best happened.
What did you learn about yourself and maybe your team from all of this?
Oh, resiliency, for sure. And, the team was amazing, and they wanted to serve. I think everybody felt the same way. Like, we had a purpose, right?
Keep on keeping on.
Yeah.
Absolutely. Well, and you know what? Information technology is one of those things that when it's working and when everything is fine, then it's not noticed. But if something goes wrong or if something's missing, that's when there can be a real problem. It sounds like you solved a lot of those problems before they became problems. You anticipated a lot, and your team worked together fabulously. So I want to thank you and all of the IT team for the tremendous dedication, for keeping people safe, for keeping people connected to their families throughout the pandemic, for allowing people to work from home and stay safe. You've been integral to the response. Thank you so much.
Okay, well, thank you.
We'll see you again soon.